Question 1. Which method should be the last resort in assisting a patient who is experiencing mild anxiety? A. Therapeutic communication. B. Deep breathing. C. Progressive muscle relaxation. D. Administration of diazepam. Answer 2. D. Non-pharmacological methods should be used prior to pharmacological methods. A patient may benefit from the nurse sitting with them and providing calm conversation over the anxiety-causing issue. Deep breathing is a well-known calming technique used to calm the nervous system and can help in cases of anxiety or panic attacks. Progressive muscle relaxation can be used to encourage the patient into a more relaxed state. Question 2. Which of the following statements to the type 2 diabetic patient by the nurse is correct? A. Eat less fruits and vegetables and more grains. B. Try to wear closed-toe shoes whenever ambulating. C. Minimize physical activity to prevent fatigue. D. Check your blood sugar only after meals. Answer 2. B. The correct statement by the nurse is that the patient should wear closed-toe shoes when ambulating. Patients with diabetes are at high risk for impaired sensation in their lower extremities and may develop wounds that are difficult to heal. Patients with diabetes should be encouraged to eat more fruits and vegetables. Increasing physical activity is another way the patient with diabetes can regulate blood sugar levels. If the diabetic patient is checking blood sugars, the levels would normally be checked prior to meal. Question 3. The nurse prepares to perform the initial assessment on a school-age client. The client has an open wound infected with methicillin-resistant Staphylococcus aureus. Which precaution will the nurse take? A. Wear gloves only. B. Wear gown and gloves. C. Wear gown, gloves, and mask. D. No precaution are necessary. Answer 3. B. MRSA requires contact precautions. The nurse should wear clean, non-sterile gloves and gown when entering the client's room. And when having any contact with the client or with surfaces that the client touches. Question 4. The home care nurse visit a client diagnosed with acquired immune deficiency syndrome, AIDS. The nurse instruct the client caregiver about how to prevent infection. Which is the important instruction the nurse will give to the caregiver? A. Cover your nose and mouth when you cough. B. Get rid of all pets in the home. C. Wash the client dishes separately. D. Wash your hand frequently. Answer 4. D. Hand hygiene is the single best way to kill germs. The caregiver should wash hand after going to the bathroom and before and after fixing food. The caregiver should also wash hand before and after caring for the client. Question 5. The nurse enters the room of a patient complaining of lower back pain after a left hip replacement surgery. What non-pharmacological intervention would not be appropriate? A. Reposition the patient onto the left side. B. Massage the patient's back. C. Lower the head of the bed and elevate the patient's legs onto a pillow. D. Apply a warm pack to the patient's back. Answer 5. The patient should not be repositioned onto the side where the hip surgery took place, as this may cause decreased circulation or improper healing to the hip or cause more pain to the patient. The patient can be repositioned from supine to the right side. Massage is an appropriate method for nursing staff to use in decreasing pain for the patient. It is appropriate to lower the head of the bed to elongate the patient's back. It would be acceptable for the nurse to obtain a doctor's order prior to heat application. Question 6. Which of the following lab tests would be considered point-of-care testing? A. Urinalysis. B. Sputum culture. C. Complete metabolic panel. D. Blood glucose. Question 6. Which of the following lab tests would be considered point-of-care testing? A. Urinalysis. B. Sputum culture. C. Complete metabolic panel. D. Blood glucose. Answer 6. D. A blood glucose would be considered a point-of-care test as the test can be completed at the bedside with the result given immediately. A urinalysis, sputum culture, or complete metabolic panel would not be considered point-of-care tests because these tests need to be run in a laboratory setting with specialized equipment not available at the bedside. Question 7. A student nurse interns at an outpatient health center. Which of the following responsibilities of the student nurse are considered tertiary prevention strategies? A. The student nurse administers a PPD test for employment. B. The student nurse administers a flu vaccine. C. The student nurse gives a presentation on diet and exercise. D. The student nurse gives Bactrim to a patient with a UTI. E. The student nurse administers acyclovir to a patient diagnosed with hepatitis C. Answer 7, D. E. The flu vaccine, and the presentation on diet, exercise are examples of primary prevention. The PPD test is secondary prevention. Giving Bactrim and giving acyclovir are examples of tertiary prevention. Question 8. The nurse is assessing a client with a suspected diagnosis of hypocalcemia. Which clinical manifestation would the nurse expect to note in the client? A. Twitching. B. Hypoactive bowel sounds. C. Negative Trousseau sign. D. Hypoactive deep tendon reflexes. Answer 8. The normal serum calcium level is 9 to 10.5 mg/dl. A serum calcium level lower than 9 mg/dl indicates hypocalcemia. Signs of hypocalcemia include paresthesis followed by numbness, hyperactive deep tendon reflexes, and a positive Trousseau's or Kvostek's sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizures, irritability, and anxiety, increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. Question 9. A student nurse is giving a child with suspected otitis media an ear examination. Which of the following actions, if taken by the student nurse, would require correction? A. The student nurse allows the 2-year-old to sit on her mother's lap during the exam. B. The student nurse gently pulls the pinna of the ear up and back to straighten the ear canal. C. The student nurse talks with the child as she looks into her ear. Answer 9. C. The student nurse should pull the pinna down and back in a child to straighten the ear canal. It's fine to talk with a child and sit them in the mother's lap. Question 10. The clinic nurse reads the results of a tuberculin skin test on a 3-year-old child. The results indicate an area of induration measuring 10 mm. The nurse should interpret these results as which finding? A. Positive. B. Negative. C. Inconclusive. D. Definitive and requiring a repeat test. Answer 10, A. Induration measuring 10 mm or more is considered to be a positive result in children younger than 4 years of age and in children with chronic illness or at high risk for exposure to tuberculosis. A reaction of 5 mm or more is considered to be a positive result. For the highest risk groups, such as a child with an immunosuppressive condition. Question 11. Which of the following symptoms would a patient exhibit with hyperthyroidism? A. Intolerance to cold. B. Decreased bowel movements. C. Slow heart rate. D. None of the above. Answer 11, D. A patient with hyperthyroidism will present with the opposites of the listed symptoms. Too much thyroxine is produced, causing the body's metabolism to rise. This leads to an intolerance to heat, a decrease in weight gain, increased bowel movements, a rapid heart rate, and warm, clammy skin. Question 12. A male client has a tentative diagnosis of urethritis. The nurse should assess the client for which manifestation of the disorder? A. Hematuria and pyuria. B. Dysuria and proteinuria. C. Hematuria and urgency. D. Dysuria and penile discharge. Answer 12. D. Urethritis in the male client often results from chlamydial infection and is characterized by dysuria, which is accompanied by a clear to mucopurulent discharge. Because this disorder often coexists with gonorrhea, diagnostic tests are done for both and include culture and rapid assays. Hematuria is not associated with urethritis. Proteinuria is associated with kidney dysfunction. Question 13. The nurse is caring for hearing impaired client. Which approach will facilitate communication? A. Speak loudly. B. Speak frequently. C. Speak at a normal volume. D. Speak directly into the impaired ear. Answer 13. C. Speaking at a normal tone to the client with impaired hearing and not shouting are important. The nurse should talk directly to the client while facing the client and speak clearly. If the client does not seem to understand what is said, the nurse should express it differently. Moving closer to the client and toward the better ear may facilitate communication, but the nurse should avoid talking directly into the impaired ear. Question 14. The nurse is performing an assessment on a client with a suspected diagnosis of cataract. Which clinical manifestation should the nurse expect to note in the early stages of cataract formation? A. Diplopia. B. Eye pain. C. Floating spots. D. Blurred vision. Answer 14, D. A gradual, painless blurring of central vision is the chief clinical manifestation of a cataract. Early symptoms include slightly blurred vision and a decrease in color perception. Question 15. The nurse is evaluating the status of a client who had a craniotomy 3 days ago. Which assessment finding would indicate that the client is developing meningitis as a complication of surgery? A. A negative Kernicks sign. B. Absence of knuckle rigidity. C. A positive Brudzinski's sign. D. A Glasgow Coma Scale score of 15. Answer 15, C. Signs of meningeal irritation compatible with meningitis include knuckle rigidity, a positive Brudzinski's sign, and positive Kernicks sign. Knuckle rigidity is characterized by a stiff neck and soreness, which is especially noticeable when the neck is flexed. Kernicks sign is positive when the client feels pain and spasm of the hamstring muscles when the leg is fully flexed at the knee and hip. Brudzinski's sign is positive when the client flexes the hips and knees in response to the nurse gently flexing the head and neck onto the chest.